My name is Barbie. I am one of the hygienists at Center for Dental Implants, and I have been working here for probably 17 years now. What inspired me to become a dental hygienist is the relationship that I build with my patients. What I love more about my profession is I knew at some point in time I was going to go ahead and have a family, and I wanted the flexibility to be able to not only fulfill motherhood but also my professional aspect of my career as a dental hygienist. A typical new patient appointment and what the patient can expect is detailed examination. We will take an array of x-rays. We will go ahead and do a three-dimensional scan, a complete examination, a complete perio examination from the hygiene department, which would be me, and then a complete comprehensive examination with the doctor. Once those examinations are completed, we go ahead and we go step by step with the patient as to what therapies the doctor would recommend and how we would incorporate dental hygiene to make sure that the foundation is nice, solid, infection and disease free, so that the patients not only invested therapy but occlusions and removal of diseases and cavities all combined with each other, so that the patient can have longevity of their teeth for the rest of their life. In the office, we offer an array of sedations. We offer nitrous, which is laughing gas. We offer oral sedations. We offer intravenous sedations, obviously under the supervision of the doctor and under the supervision of our on-staff nurse. For the patients that don't want that or don't require that, we also calm the patient with oils that soothe the patient. We take our time. We are thorough with our explanations. If our patients need us to stop and give them a break, we stop and we give them breaks, and we make the patient as comfortable as possible to get their therapies done. And we go as slow as possible to get their therapies done. It is very important, and the reason why patients should definitely not skip their dental visits, whether it be with the hygienist or whether it be with the doctor, is because whatever good you've achieved to that point will reverse. Unfortunately, regardless of how good the patient flosses, how good the patient brushes, they're only going to be able to reach to a certain extent. What happens is that when this bacteria and infections start to build up in numbers, this infection and this bacteria is in your mouth, and when you eat and drink anything else, it is introduced to the rest of the organism, causing significant health issues that are related to coronary heart disease, septic ulcers in the stomach, cancers, dementia, Alzheimer's. I could go on and on and on. Another reason why it's so important for them not to skip their appointments is because if you're due for x-rays, we're not taking x-rays just for peak sake. We're taking x-rays because with our naked eye, there's only so much we can see. This gives the doctor the ability that if there is anything happening underneath the bone, underneath the gum line, that we cannot see with our naked eye, again, we go back to the preventative therapies. Try to do something conservative and preventative before it actually becomes a treatment that's going to be much more invasive and aggressive for the patient. By educating my patient, I don't only sit and show them x-rays. I go ahead and I recommend mouthwashes. I recommend oral aids to help them stay to their healthiest potential. If I have to demonstrate things, I go ahead and I demonstrate. If my patient has any questions, I tell them to pick up the phone and call me. And when they come back for their recall, I tell them whatever questions they have with any of the gadgets, whether it be a water pick, whether it be an electrical toothbrush. If they have any questions on how to use it, I tell them to bring those auxiliary aids with them so that we can go ahead and go over it so that they can know exactly what it is that I expect and how we can maximize the products that they're using to help them maintain the best they possibly can and minimize any additional therapies. Since this clinic clinic, apart from the other practices I have and I worked at, is the fact that we have every specialty in-house. If we need a patient that comes in for an examination, a filling, we could do that. If we have a patient that comes in and needs extractions, needs sinus lifts, bone augmentation, needs implants, we could do that as well. We could do basic cleanings. We could do anything that's cosmetically involved. We could do gum therapies. And there's just an array of therapies that we are able to offer our patients with the convenience of pretty much doing everything. How important it is to be consistent. Being consistent with your recalls every 6 months, every 3 months, every 4 months, whatever it is that you fall into as a patient, you have to be consistent. You have to make sure that you are your own advocate and that you're aware of the fact that you need to get your gums probed and measured at least once a year. You need to have your oral cancer screening at least once a year. You need to have an examination and x-rays done at least once a year. Without these tools, we cannot fulfill the patient and make sure that we are able to take care of the patient the way they need to be taken care of for them to be in the preventative mode. We don't want to recommend treatment unless we absolutely have to. And if we could go ahead and take the prevention route, that's the route we want to take.